From Wits and Weights, I'm Philip Pape, and this is Nutrition Science Daily, bringing you the latest in nutrition, fat loss, and health science, all in under 5 minutes. Today, we're talking about leadership changes at major health agencies in the U.S. and how they might influence public health policy, including guidelines for nutrition, food safety, and corporate accountability. With these appointments, there's a lot at stake, so let's break it down, and I will try to avoid politics and keep this objective. President-elect Donald Trump has announced key appointments to health agencies, including Dr. Jay Bhattacharya to head the National Institutes of Health. Dr. Bhattacharya, a Stanford professor, is known for advocating reevaluations of public health strategies, and his nomination signals a potential shift in how health policies are developed and implemented. For example, Bhattacharya has called for reducing corporate influence in areas like food production and pharmaceuticals, which could lead to stricter regulations on processed foods and additives. He's also emphasized transparency and accountability in scientific research, which might affect funding priorities for nutrition and obesity-related studies. On the other hand, critics worry these appointments could bring political biases into public health decisions, and that might be an understatement for some of you. The role of evidence-based science may come under scrutiny if leadership prioritizes deregulation over health outcomes. It's always a challenge between business and policy, and this tension between innovation and ideology makes these appointments impactful for whatever's to come with our nutrition guidelines, as well as public trust in some of these institutions. So what does this mean for you? Well, if we look at past changes in health policy, leadership shifts usually influence the resources and the tools that we have available as consumers. For instance, stricter labeling requirements for added sugars or artificial ingredients might make it easier to identify specific options by looking at the label. On the flip side, a reduction in funding for nutritional education might mean there are fewer, say, public campaigns that promote healthy eating, if you think that those campaigns are effective. Regardless of policy changes, we want to approach nutrition decisions with a critical eye and not get, again, overly politicized about it. And here's what I recommend for staying informed. First, follow updates that come out, because it's going to happen fast and furious, from the health and nutrition organizations like the Academy of Nutrition and Dietetics or the National Institutes of Health. I'm not saying you need to necessarily follow everything they say, but at least look at what they're updating as we go forward. Then I want you to be skeptical of any sudden changes in guidelines that may or may not be supported by strong evidence, because there are peer-reviewed studies, there are professional opinions out there. They don't always jive with public policy. And then I do want you to take a long-term view. Nutrition science evolves over decades. So even significant policy changes are going to take time to impact things like the food environment. And at the end of the day, I'm a firm believer of taking control of your own environment anyway. Now, leadership changes like these remind us that public health is often a collective effort that we don't necessarily have much control over at the individual level. And while these agencies and these experts shape the big picture, our individual choices remain your most powerful tool. Whether it's prioritizing whole foods in your diet, staying active, strength training, learning to interpret food labels for the choices you want to make, whether you are eating processed foods or not, your habits matter just as much as the policies that may or may not guide them. And the bottom line here is to pay attention to these developments, but don't let them dictate your day-to-day choices. Evidence-based nutrition principles, like having balanced macros, eating minimally processed foods, maintaining consistency, these stand the test of time no matter who is in charge of our public policy. All right, I tried to keep that as minimally political as possible and just give you very high-level thoughts of how to approach this going forward so we don't get maybe too emotional about it. And if this episode gave you some insight into the intersection of public policy and nutrition, I want you to check out my main podcast, Wits and Weights, where we do not talk about public policy generally. I might reference it here and there, but more importantly, I dive deeper into strategies for sustainable fat loss and optimizing your health. Follow the show wherever you listen to podcasts and share this episode with someone curious about how public health impacts their personal decisions. Tomorrow, we'll explore an unexpected food on the list of the most nutritious: pork fat. Is lard healthier than you think? Tune in to find out.